Hi and welcome to this very special edition of Epworth Facebook Live. It's PANDA week and we're talking all things depression, postnatal depression and anxiety. My name's Susanna Hicks and I'm brand manager at Epworth Freemasons, and I'm also a very proud mother of two little girls, Claire and Sophie, so I'm wearing two hats as most mothers do these days. Now, PANDA Week is a wonderful opportunity for us all to not only acknowledge the fact that mental health is vital in everyone's life, but also particularly for new parents and mums in particular whose lives have changed in so many ways with the birth of perhaps a first child or subsequent children, and there's so many adjustments to life as they knew it. But you throw in all the other things that come with birth, recovery, and perhaps a mental health pre-existing condition, then it can be incredibly difficult time when there's all these shoulds. I should be feeling like this. I should be enjoying the fact that my baby's healthy. When it is a good time to perhaps say, this isn't normal, I need to do something about this. Who do I talk to and how do I get some help? So you might be here today because you're currently experiencing those sorts of feelings of sinking. You might be here because you know someone or love someone who is feeling like that. Perhaps you've come out the other side or are learning to live through these sorts of issues. Whatever your reason for being here today, we really hope that you'll get involved in the conversation, but also that you take something away from today. You can get involved a couple of different ways. You can either post on our Facebook page, and we'll do our best to get the answers that you want, and if not, we can follow up after. Or if you prefer to stay anonymous, that's absolutely fine. Please just send us a direct message and we'll do the same, get the answers to you. You might not know that Epworth Maternity is so privileged to be in the position to help deliver more than 3,000 babies each year. So on top of all the clinical expertise and amazing facilities, there's a team of people, professionals who really deeply care about the families that we treat, we look after and help guide through those early days. But beyond the 4 or so days that you spend in hospital, when you go home, there's still that care and that concern for how you're going. So I guess today's a great opportunity to remind people that beyond the hospital walls, that mental health is a massive part of day-to-day life and one that should be taken very seriously. Which brings me to our fabulous panellists today. We're very lucky to have Epworth perinatal psychiatrist, Dr. Andrea Ratmond here. Thank you so much for joining us. And our Epworth maternity mum ambassador and mother of two and mother of 4, all wearing several hats today, Erin G and Sarah Cuser.
Hello, thank you for having me.
Thank you for coming along. So first of all, we might start off sort of having a chat basically about what is postnatal depression and anxiety, and how common is it?
Yeah, it's incredibly common. It's probably more common than we might think. It's about 20% of women will have some anxiety around the time of pregnancy and early parenthood, and probably about 10% may actually have depression. And so often the symptoms merge and they overlap, and so symptoms of anxiety and depression commonly occur together. And they're so varied and such a wide variety of symptoms too.
So where do you draw the line between baby blues and just, I guess, adjusting to the new normal, and when you actually should be talking to a professional?
So baby blues, I mean, it pretty much occurs in everyone. I mean, maybe not 100%, but very, very high numbers, probably not 80-90% of people. And that's within the first week or so. It might be that there's a rapid change in emotions. You might be tearful all of a sudden and that kind of thing. But it passes. It doesn't persist, and it doesn't impact on functioning. It's very common in that early week or so, and then later on, if the symptoms of anxiety and depression are continuing and they're impacting on your day-to-day life, persisting, that's when we start to think maybe there's some anxiety and depression.
When you say impacting, what do you mean by that? What sort of impacts would you regularly see?
So, affecting how you're interacting with your family, even care for a baby, sleep, eating properly, all of those daily sort of functions might get impacted on. Not enjoying the things that you usually enjoy, not engaging in your usual social groups and that kind of thing. I know that's hard when you've just had a baby and things do change, but you're really not feeling yourself, not doing your usual things.
Yeah. What sorts of barriers do you think there are towards people speaking up and seeking help?
I think people are scared. I think people are scared to think that they might have developed a mental illness at this time, especially when, like you were saying before, there's that expectation that it's the most wonderful time, and it is, but it's also the most stressful time and the most vulnerable time for women, and I think there can be some shame and fear about reaching out.
Yeah. Do you think perhaps these days with people's villages being smaller, perhaps not having parents or close relatives nearby, or even just that network of friends that perhaps families would have had in previous generations, do you think that?
I do. A lot of people are isolated when they've had a new baby, especially if they're maybe born overseas, their extended family are interstate, or just a little bit disconnected for whatever reason. That's really common.
Yeah. And so what are perhaps some of the most common triggers, for want of a better word? What are the things that I guess can spark?
I think, like I said before, it's the most vulnerable time. So for any woman, it's the most vulnerable time for depression and anxiety to appear. And so that's because changes are happening in all aspects of someone's life. So the trigger, there might be an underlying vulnerability to depression and anxiety, but the trigger might be lack of sleep, or it might be that there were complications.
It's enough to send anyone lose
absolutely. Complications from birth, or changes in your day-to-day life. It might be that exercise was previously a really strong factor of keeping anxiety low, and then that changes all of a sudden for whatever reason, or work might have been a particular support, or it's just that everything sort of comes together to make it a perfect storm almost.
Yeah, absolutely. Who do you see this affect? Obviously mothers in the first instance, but beyond a mum, who else?
Can be dads for sure. Yeah, and we need to care for our fathers and consider their mental health too. I'm not sure exactly the figures, but about 10% or so of dads do have some depression or anxiety around this time. They're not going through the physical changes, but everything else is the same for them in terms of changing family dynamics, changes in their work structure and finances and relationship with your partner. So all of those things affect dads just as much.
And I've heard a lot of men say, you might have heard your husband Mick say this too, even in labour, having that completely powerless feeling of,
right.
I'm watching the woman I love go through this, and then if you're breastfeeding, they're sort of how can I help? Plenty of ways you can help, but that's another day.
But you're right, it can be terrifying for dads, the labour and postpartum complications. If their wife's been rushed off for blood transfusion or whatever might have happened that needs attention, that can be really scary for dads.
Yeah, absolutely. So, I guess the big question, can it affect anyone?
Absolutely. Yeah.
So even if you've had no worries in the world.
Absolutely.
Yeah. Are they perhaps the people who find it harder to seek help because they don't know what it is?
Perhaps, yeah. We can have a history of mental illness and you might know what that might be and then seek help. But I think, if you've never struggled with this kind of thing before, it can be mysterious.
Yeah. Also, we touched on earlier in the fact that the village is so important, and I applaud anyone who speaks out about mental health, any type of mental health. And Erin, as a mum and talking to other mums about your experiences, how's that been for you, and what sort of response have you had? Perhaps if you could start with a bit of a background as to what you've experienced.
Sure. I didn't have a history of mental illness. I would describe myself pre-kids as being a warrior, but not someone who had anxiety. After my first son was born, and it was probably a good 9 months after he was born, I had my first panic attack. And that was really scary because I'd never had one before and I didn't know what was going on.
Was it a physical reaction?
Yeah.
Wow.
It was a physical reaction to something which sounds quite silly. But at the time, I'd walked down some stairs with him, and then I'd had this vision later that night that I could have dropped him while I was walking down. And instead of rationally saying, well, that didn't happen, Erin, and he was fine, I spiralled to the point of the worst possible outcome. And that started to happen a fair bit. So I sought help from my own mother's group, from my husband, from my mum, and they all said, yeah, that shouldn't be happening. So I was really lucky that I felt comfortable enough to do that and got help at the time. Fast forward a few more kids down the track, and just this year I had a similar situation starting to evolve. So my youngest is nearly 3, but at the time she just turned 2. And whether it was a hormonal shift in my body, whether it was, could be any number of things, I don't know. I started having quite rapid heart rate, like I could feel my heart beating out of my chest and a tight chest. So I went to my GP and she just said, look, you've got 4 kids, that's all it is. So that was hard. It actually made me go the opposite direction and not tell anyone because I felt silly. I thought, well, maybe it's sleep deprivation, maybe it's just me not handling having 4 kids. Why do I have 4 kids? But it didn't go away, and I tried all the things that I'd used the first time around. So that was like cutting caffeine out and doing a whole heap of sort of natural options, and still nothing. And it got to the point where I thought I've got to speak to my husband, and his reaction was he was quite upset that I hadn't come to him earlier. So he was comforting of me, but he was like, why did you leave it this long, and you've been suffering for months? And for me, when I have anxiety, nobody really knows. I'm very good at putting on an act.
That's exhausting.
It is exhausting, and it makes it so much worse.
Yeah.
So I think A, admitting it, B, getting help for it, I just felt a release, like an immediate release. And then obviously having, an action plan for dealing with it. So it was a good few months, and even now, I would say 90% of the time I feel really good and quite level, and then 10% I don't. And I'm probably now going to be just someone who has anxiety in their lives. But it's knowing the signs, knowing when it's getting to an unmanageable point. As for speaking about it, that came easily with my network of people on social media, because I felt I had a duty to talk about it.
Thank heavens you did, because I'm sure you would have had responses from people who said, I felt exactly the same way.
So many. And people who, like me, had possibly spoken to someone, not necessarily a GP, but a relative, and they'd kind of gone, everyone feels like that, or that's normal, when it's like, no, if it's, like you said, if it's stopping you from enjoying your life. And that was one thing I noticed when my anxiety lessened. I was enjoying things again, and it was then I realised I hadn't been. But also, often those with anxiety, like people around them might not even know that they're suffering. And every day I get a message from someone saying, thank you, because now I feel like I could talk to someone, or you've given me some confidence in that. So I would never take that back, that I've been really open and honest about it.
Thank you. Is that a fairly common story?
I'm just going to say, so many times a woman will come and see me and then just let it all out and talk about it, and the relief, they say is pretty instant,
Massive,
because we try and sometimes suppress these feelings, and they build and build and build, and then to actually speak about them and come up with a plan, like you say, you know, because that's how we often manage anxiety, is by having some structure and a plan, and that can be really reassuring. So that's really really a common experience.
Yeah, well, that's good to know.
Interesting hearing you talk about social media in that really positive way, and I know Epworth works really hard to have open discussions about things like this and clinical information on things like breastfeeding and There's the other side, obviously, to social media as well. Do you see that play a part sometimes in people's anxiety?
People can look too much and look into things over and over and get really preoccupied with that. So sometimes it is wise not to spend too much time. It's hard, isn't it? Because sometimes it can be a real support to, you know, say you've got a group that you find supportive on social media, then other times it can
perhaps be selected, unfollowed, mute for a while.
Just, I guess, be thoughtful about how much and how helpful it is to you, because you know,
how much you feel.
We know that if we start worrying more, obviously it's not
not the
right one.
Yeah, absolutely.
On a totally different level to what we've just been discussing, postnatal psychosis, how common is that?
That's much rarer. Off the top of my head, I don't remember.
The
figures, but it's far less common, but obviously very serious and a medical emergency, and we need to consider safety of mum and baby and inpatient treatments usually.
How does that present itself? Like, at what point do you really need to press the panic button for something like that?
So usually there'd be some kind of delusion being expressed, unusual behaviours that the family are quite worried about, and that would usually need immediate care through local mental health team, crisis team, emergency department, that kind of thing. So that can come on very quickly. And usually that would be noticeable by the things that people are saying and doing. But certainly, very serious situation if mum might be having thoughts of harming baby, or that there's very unusual things going on. So.
What advice would you have for anyone who is in crisis at the moment?
That would be to attend your local emergency department or call the local area mental health for immediate mental health care.
And I guess one thing that we'd love to get across today is the fact that you're not alone. No matter what part of this journey you're on, whether you are yet to perhaps identify that you have an issue, or
because it can take time to get to that point. I think that even for me, I think having that word, I struggled to accept that for a bit of time, that I have anxiety. But I think even if you're having those feelings, just allow yourself a bit of time to be kind to yourself, basically.
And did you find it took a while to then say it out loud?
Yeah, absolutely. Now I'll just shout it from the rooftop. She's talking about anxiety again. Here we go. But it took a really long time to get to that point. And I hate to admit, I think I'm a bit of a control freak, and so a lot of us are. And that's probably a characteristic. I can see you nodding. So I think that a lot of it stems from that. But then that personality type, it can be very hard then to make that sort of statement about yourself, because for so long you were in control of who you are and your emotions and everything, and then suddenly you have children and they
no
control.
Is that something that you said, as you said before, you might not have had mental issues before, but are there certain personality types that it might hit?
I was just thinking about that tendency to worry or have anxiety, and we may manage that by maintaining order and control in our lives, and trying to make things certain. And then, like you say, during pregnancy or early parenthood, that just totally goes out the window. And that can really be a trigger in itself.
Women who are pregnant and might be suffering anxiety about their pregnancy, about what lies ahead, do they often then go on to have anxiety post-birth? Is it something that carries through, or is it something that might change once the child arrives?
It can carry through. If things are not going so well beforehand, then it's more likely that there might be some anxiety or depression after. But having said that, if you seek help and attend to those issues early, then things can improve pretty quickly. And often it's about seeking advice, asking the questions, like in terms of maternity care as well. Because if we have that tendency to anxiety, we can ruminate on doubts that we might have or worries, and yet if we seek advice from our care providers, then that can really allay that. So.
And it's important, I'd imagine, that your obstetrician and your maternity care team know that that's how you're feeling.
Absolutely, and especially if there's any trauma in your past that might be being reactivated with the thought of giving birth, or perhaps even breastfeeding, that some of that can be delicately discussed between psychiatrist, psychologist, GP, obstetrician, whoever's involved, to support the woman as much as possible throughout that part of it.
Erin, what sorts of experience and how would you help in a conversation if you had a cup of coffee with one of your blog followers who hadn't got to that point of realising yet that there was something wrong, and yet you could see that was just where you were how many years ago now? What would you say to them?
I think rather than impart advice, I would just say, do you want to talk? Because sometimes just opening that door is enough. I think if someone had tried to push advice on me before I was at that conclusion, I don't know how I would have accepted that. But also I want them to know that they don't have to feel the way they're feeling forever. This is a temporary thing that can be fixed. And I think when you're in it, it's really hard to see your way out of it, and you think, even now sometimes if I have an anxious day, I think that's it. So we're back here, and then you wake up the next day and you're fine, and it might have just been you didn't sleep well the night before or anything. So yeah, it's sometimes hard to see your way out of it, so just give them that hope that, this can be fixed, and there's lots of people willing to help.
Absolutely. And even as you say, if you don't have any experience, but just having that open ear and open mind to have a conversation with someone. I guess, what advice would you have if someone who's involved today knows someone that they're not themselves, they might be struggling? What advice would you give them?
There are so many resources out there. PANDA for one, GP. Talk to someone that you know and trust. It doesn't have to be a professional to begin with, just someone that you know and trust to talk to, and then seek out the most appropriate service. But so many avenues for help. It really is about just having that conversation to begin with, I think. And your GP, of course, so important.
And knowing that by admitting it, you're not failing. Because I think deep down there's that element there that I should be, like you were saying before, I should have it together.
Such a dangerous word. My baby should be sleeping through the night. My baby should be, walking by now. There's so much pressure.
There is. And really, you haven't done anything wrong. Like you said, this can happen to anybody. There are so many different triggers for it. So just be kind to yourself and just be gentle on yourself, and know that you haven't done anything wrong, and it will get better. From the moment you ask for help, it's going to get better.
And I find that it actually does get better really quickly for a lot of women. Perhaps even more so than at other times. I'm not sure, but in my experience, it's often very brief. I mean, yes, mental illness in this period can be very serious, but for many women, the recovery period is actually quite good.
It's so encouraging to hear. And as you say, even that first conversation.
That's right.
Must feel like a massive weight.
And like I say, to come up with a plan and to do that together and just have that support, it's really positive.
And you're not alone anymore. Don't have to have the mask.
No, exactly. Excellent.
Was there anything else that you would like to mention that we haven't covered, or top advice?
Oh, I just was thinking that sometimes people do have worries about medications in pregnancy and breastfeeding, and I would just say that have a chat with your GP about it. We want mum to be healthy, and that's best for baby, and so most often people would stay on their medications, but it's an individual risk-benefit analysis for mum and baby, so we look at that each particular woman and make recommendations, but you can just have a chat with your GP about that, and as I say, usually you just continue on your current medicines, but every woman has particular circumstances. So.
Yeah, well, that's wonderful to know that there's that sort of support as well.
Yeah.
Erin, is there anything else that you think we should cover off as far as the village or your experience?
Yeah, look, I think even if you feel alone, you're not. So a lot of people that will message me say, I couldn't speak to anybody, but reach out to a stranger, or your GP or somebody who you might not even have a relationship with. But also don't be in fear that you're going to be judged, because everyone is really understanding about this, and I think the more we discuss it, the more understanding people become. So
let's do it.
Yeah, absolutely. So do it.
Do you think in some ways it'd be easier for a woman who's struggling to speak with a complete stranger and that feel that they're not perhaps necessarily being judged by anyone?
Yeah, maybe. I mean, with your phone, Lifeline or PANDA phone line or some of those things.
Yeah.
Sometimes that anonymity can be a little bit of a easier way to start the conversation.
But whatever way works for you.
Yeah.
Excellent. Well, thank you so much for joining us, Erin and Andrea.
Thank you for having me.
It's wonderful to have you both, and thank you so much for being a part of today's discussion. If you have any queries, please feel free to send us a message, and if you are in crisis, please seek help. You are not alone, and we encourage you to head on to the PANDA website, head on to the Epworth website, and get as much information as you can, either for yourself or someone you love. Take care. Bye.